So we're looking at another application. That's a protein. That's what is known as the alpha fetoprotein. Okay, so look at alpha fetoprotein. We'll describe what alpha fetoproteins is. We'll look at the applications of alpha fetoproteins and all of that. So first of all, just so you know that it's a glycoprotein. It's primarily produced by the fetal liver, the yolk sac, and the gastrointestinal tract, right, during development. So it actually plays a key role in prenatal screening and oncological diagnostics. So you should know that it's mainly found in the fetus. But it can be found in the elderly people when there are some problems. So when you see the levels being rising in an elderly person, you suspect a problem. So alpha fetoprotein is measured as part of maternal serum screening, right, like the triple or quad screening between 16 to 22 weeks of gestation, right? So once you see the levels being high, it indicates that if it is a fetus, then maybe the baby will come up with some spinal bifida or those neural tube defects. Maybe there's abdominal wall defect like omphalocele. Maybe there's multiple gestations, incorrect gestational dating. So if you see the levels are being low, you have some congenital anomalies like Down syndrome, Edwards syndrome. Alright. So normal alpha fetoprotein levels don't confirm a diagnosis, right? So they prompt further testing. Okay, abnormal levels, right? It's just something that will help you think further. It's not the final say. So in adults, we say that it's a tumor marker for, like, when you see the levels rising in adults, you can be suspecting some tumors coming up, like hepatocellular carcinoma, alright, tumors of the testes, tumors of the ovaries, then also liver disease. Sometimes it's liver cirrhosis, hepatitis, and all of that. So it's also used to monitor treatment response, alright. So sometimes you have established that somebody has a tumor. So as you are treating the person, if the levels of alpha fetoproteins are going down, you know that, okay, the treatment is basically becoming effective. It can help you to also dictate reoccurrence after cancer treatment. It can help you to assess prognosis in liver cancer. Right. So fun fact, we say that it's structurally similar to albumin and may function as a fetal transport protein. So after birth, its levels rapidly decline. Right. So normally, it should decline. You find it being rising in an adult, they can be suspecting all those disease conditions that we listed.